Good evening. It's great to have you here. I am a registered dietitian, and I work here at the Pennington Center and at the LSU Ag Center. And what we do is we offer programs to the public on healthy eating, programs that are available to anyone who's interested in them. We also have a lot of information about nutrition, eating healthy on the Pennington website and also at the LSU Ag Center website. I'm here to tell you how to eat the rainbow, or hopefully help you to eat the rainbow. One of the things is eating the rainbow means just thinking about when you go to the store, buying all different kinds of fruits and vegetables, and making sure that you bring them home and you use them. But what I wanted to talk to you first about is dietary guidelines for the Americans. What are those? What are the dietary guidelines? Why do we encourage for you to eat fruits and vegetables? Well, one of the reasons is if you are interested in eating well, there's a website called mypyramid.gov, and that, if you go there, it actually shows you an eating pattern based on your caloric level, and you can assess your caloric level as well. But the kind of diet that the Dietary Guidelines for Americans recommends, and that's on that My Pyramid website, is the most researched diet there is, I can tell you, because the recommendations that are made on that website, there's a huge amount of research, similar to the type of research that's going on here at the Pennington Center. And in terms of fruit and vegetable intake on a 2,000 calorie diet, currently the recommendation is to have 2.5 cups of fruits and vegetables a day. And the recommendation is to have 3 cups of vegetables. And the vegetables then are on top of that, instead of just saying vegetables in general, they are broken up into different types of categories. So we have dark green vegetables. That will be your collard greens. We talked about collard greens here earlier when I was over there at the booth. And spinach, even your darker lettuce, all of that is your dark green vegetables. Your broccoli, etc. Then you have orange vegetables, a whole category of oranges, pumpkins, carrots. The recommendation is to have 2 cups a week of those. Now, legumes. How many of you, I'd like to see actually hands up, how many of you actually know what legumes are? Okay, you know legumes. Do you consume legumes on a regular basis? That would mean what? Your red beans and rice, for example. That would be in this category of legumes. Starchy vegetables. We all know what starchy vegetables are. That will be potatoes, sweet potatoes. And I think most people, based on studies that have been done, actually consume enough starchy vegetables. And then others would be onion, garlic, that don't categorize into the other groups. But those also have components in them, and Dr. Chambane is going to talk in just a minute about what is it in fruits and vegetables, why we need to eat them. And so she'll tell you more about what's in the fruits and vegetables. So now we know we should have 2.5 cups of fruits a day. We should have 3 cups of vegetables. And in a week's time, we should have 3 cups of green vegetables, 2 cups of orange vegetables, some legumes, about 3 cups a week, 3 cups a week of starchy vegetables, and then other 6.5 cups. Now, does that seem like an awfully lot? It seems like an awfully lot, doesn't it? But if you think about what you eat in a day's time, and cup, I didn't bring a cup measure with me, but a cup measure is really actually not that much. And many times when we build a salad, for example, we have much more than a cup on a plate. All right, what I wanted to do is just walk through some typical menu items and show you how you could add more color to that. So if you think about having, many of you work and you have to go, you know, you're in a hurry in the morning, you might not be able to prepare breakfast. You might think about, well, I'll pick up something on the way. Well, the problem is many times when we do that, what's missing in that meal are fruits and vegetables. We many times, when we do pick up, we pick up from places that don't have them available. So you need to think about, okay, how is it that I could make it better? I'm not telling you not to have that egg biscuit, for example, in the morning. There's, you know, you have your starches and you have your meat and there's some dairy in that cheese. And those are all from different parts of the pyramid in there. But think about adding more of fruits and vegetables in it. And why do we want to have more fruits and vegetables? And Dr. Champagne is going to talk about that again a little bit later. But those are the components that help us that prevent chronic diseases. Do you know that what you eat when you are 20 and 30 is going to determine, in many ways, what your health will be when you are 40 and 50? And I don't think that we really think about that. All right, let's think about another breakfast. A lot of people have cereal. It's easy and quick. Just pour a little milk on it, and you're ready to go. But think about having that same cereal, but dress it up a little. Think about having some fruit at home, and think about adding that, taking that extra minute to slice up some fruit or having something in the freezer that you can add to it. We talked about out at the booth there earlier that, for example, blueberries, you can freeze them. When you go and pick blueberries, you can put them in your freezer, and then you can put those in your cereal, for example, in the morning or in your oatmeal when you cook it. And it's an easy and simple way of adding more color in your meals and adding fruits and vegetables. What about coffee break? The famous coffee break in the morning. And what do we have most of the time? A lot of the time I see this. And occasionally it's okay, but if this is what we have on a consistent basis, what are we missing again? We are missing those colorful compounds that are going to be antioxidants in the body. They'll help us prevent chronic diseases. They'll help prevent aging. Women, if you like fruits and vegetables, they'll help keep your skin really radiant and in good tone and color. So think about having something like this instead. I have in here, it's a whole grain biscuit with some raisins in it and have some grape. And even if you add a little jam, that adds some of the colorful compounds that you need more in the diet to prevent chronic diseases. Dr. Cefalu talked about abdominal obesity being a problem in terms of diabetes development. Well, did you know that if you eat whole grains, there's actual research that shows that whole grains, those people who consume whole grains have smaller waist circumference than the ones that eat white processed wheat most of the time. So there's research to show why we should eat what the recommendations are. For example, we should have half of the grains that we do eat should be whole grains. So think about taking, instead of going for the donut in the morning, think about bringing a homemade whole grain biscuit and a little bit of grape on the side, and that could be your snack in the morning. And you'll have much more healthful compounds that can help prevent chronic diseases. All right, what about your typical lunch? A lot of the times, what do? We're in a hurry again. Or we're all of a sudden hungry. We might be on the road, and this is what we want. So it takes a little thinking what you might want to do. Again, I'm not telling you not to have that burger, but think about dressing the burger up with something that's a little bit healthier. Keep the burger small, because unless you do a lot of physical activity, you most likely will not need all those calories that the burger will provide for you. So you want to go for the smallest burger there is. and dress it up a little. Have a salad. Have some green salad with it. Have low-fat dressing on the salad to keep the calories down. And what about having either an iced tea in place of a soft drink? There's lots of wonderful research that shows that iced tea or tea, and particularly green tea, is a really wonderful, healthy food or drink. And think about replacing the carbonated beverages that you do have with either juices or tea instead. And so with that, you've added a lot of different types of phytochemicals to your meal that are very helpful over time. All right, let's move on to another type of sandwich, a lunch that's typical, and that's sandwich. What do we have again? We have a sandwich many times. We have chips with it and a drink. All right. Now, what could we do? What can we do to dress that up a little bit, to add some more healthy nutrients in it? What about bringing in, if you bring a sandwich to work, add a little cut up fruits, vegetables, carrots, and celery sticks. Those are inexpensive. They stay in the refrigerator for a couple days. If you buy some, you can already buy the ready cleaned carrots, the little ones if you like those, or you can buy the regular carrots and peel them yourself. So many of these products in the store, they are already ready-made for us. We can buy cut up vegetables. They are ready to go. They are pre-washed. All you have to do is take a portion size of those with you. So think about in the morning before you leave for work, how could you dress up your meal and make it a little bit healthier? And that way you'll be ready in the morning when it's time for you to leave for work and dress it up a little. In this one you have fruits and vegetables instead of the chips and the drink. And what's going to be very different in terms of these two meals, the caloric content and fat content, because the chips, it doesn't matter what kinds of chips they are unless they are baked, but if you buy regular chips, they are very high in fat and they have lots of sodium. And if you can replace those with something that's healthy, fruits and vegetables, and a piece of fruit, that will be much better. What about an afternoon snack? I know chocolate is good. There's lots of research that shows that chocolate is good for you, and occasionally it's all right. But are there other things that you could have? For example, if you have a taste for sweet, what could you have that would be a little bit healthier than having a candy bar? You could have a piece of fruit, right? You could have a plate of fruit. So again, it just takes a little bit of planning ahead of time to bring, for example, some fresh fruit to work, or if there's a place that you know where you can go and get some. A lot of the times I've noticed, even now at when you go to, when I go and get gas from and they have little shops, they've even started to carry pieces of fruit that you can buy over the counter over there. So instead of just having the candy bar, which is okay occasionally, but if you have fruit, you're cutting a lot in terms of the amount of fat that you have, the amount of sugar, calories. So over time, there's a huge difference, in terms of how many calories you've eaten over a year's time, for example. What about if you crave for something that's salty? Can you think of something that you could have that would be healthier, that wouldn't be quite as... You could have walnuts. Popcorn is excellent. Yes. Again, think about having, a little bit preparation ahead of time. It looks pretty. And that would satisfy anybody's salty and sweet taste all at once. Again, it's much healthier for you because you have a little bit of protein in it, you have some dairy, you have fruits and vegetables, and you have all these wonderful phytochemicals that can help fight chronic diseases and help you stay healthier. All right, we're moving on to evening meals. And what do we have here in South Louisiana? You know, I work for the Ag Center, and a lot of my, what I do on my job is I have to travel across the state. And in many places I've noticed, this is what they have. It may not be fried shrimp, but it's some kind of fried seafood. Seafood is a wonderful food to have. It's very heart healthy. It's low. It has the right kind of fat. It's an excellent, easy to digest protein. But what do we do to it? We fry it, and so we do something that's not very healthy. We make it not healthy by frying it, I guess. But what could you have in place of having, for example, the fries or the white roll or the vegetables that are buried in a creamy sauce? Think about having, again, a whole grain product with that. Dressing it up with some vegetables. You know, most of the time, obviously, when we are in nutrition, and if you ask a dietitian, we're going to tell you that fresh fruits and vegetables are the best. But we understand that people also, you know, you can't always have fresh available. Think about having frozen fruits and vegetables in the freezer for those times when you're in a hurry, or you might not be able to go to the store and replenish your fresh fruits and vegetables. Have some in the freezer that's ready to go. There's nothing wrong in either frozen or canned fruits and vegetables. Now, what do we want to avoid when we're talking about canned vegetables and fruits? We want to avoid the heavy syrup in the fruits. So look for fruit, canned fruit that says in its own juice, for example, that it's not heavy syrup. And what about vegetables? There tends to be a lot of salt in the canned vegetables, so you want to look for if it says low sodium, or certainly when you get home, rinse the vegetables before you add them in the food. And then when you use canned vegetables in any kind of cooking at home and you add it, for example, into a soup or stew, because they already have a lot of salt in it, don't put the salt in the food until you are close to serving it, because most likely the salt that was in the canned products was enough salt for to make it taste salty. So avoid adding additional salt, certainly when you use canned products. But there's nothing wrong in having all of that, having canned fruits and vegetables, having frozen fruits and vegetables. Of course, we would prefer if you can eat fresh, because that has the most nutrients in it. But we understand that, you know, we cannot do it all the time. So we have to rely on others as well. And that's, you know, you think about convenience when you travel, you go to camp for the weekend. Well, you might want to keep some things that are canned in there. It's just important to have them. The form is less important. All right, what about having an Italian meal? We have this and maybe some garlic bread on it, with it. And it has a little tomato sauce in it, I agree. So that's the vegetable part to it. But what else could we add to it? Think about having a salad, a green salad with your meal. And you can dress it up that way, and think about having a low-fat dressing. How many of you prepare your own salad dressings, for example? Okay. Have you ever tried to fix your own salad dressings? That's one way. One of the things that you can do is that you can combine oils and vinegars, and it's kind of fun because you can add different herbs to it. Dr. Cefalu talked about herbs being very helpful, for example, in preventing diabetes and other chronic diseases. Well, you can use a lot of herbs, for example, when you make dressings. One of my daughter's favorite dressings, actually, during the summer is I use olive oil, lots of fresh basil leaves, and garlic and lemon juice. Of course, a little salt. But she loves that, and it's very healthy for you. It's very flavorful. It adds lots of good phytochemicals in it. And it's much healthier than having a product that has lots of salt, and you wonder about the oil content too. So just in terms of then using oils as well, how many of you have heard about using olive oil? Olive oil is a good kind of fat. It's heart healthy. That means it promotes heart health type of eating. All right, so how do you make sure that you and your family will eat more fruits and vegetables? What do we need to do? That's right. We need to buy fruits and vegetables. If we don't bring the fruits and vegetables home, our family, are they going to be able to eat it? No. So think about the kinds of things that you have available for your family to eat. What's in the pantry? What's on the counter? If you make the fruits and vegetables available and you buy them, that's what people are going to eat. But if your pantry is full of junk food, that's right, or cookies or candy, that's what they're going to eat. So think about what you have available in your home. And if you think it's too drastic to throw it all out at once, at least, make a mental note and start switching to healthier. Maybe not having as many chips, but moving more towards healthier popcorn and pretzels, and then fruits and vegetables. Cut up vegetables in the refrigerator, and have them over. So when someone goes in the refrigerator and opens the door, they can see it, or that you have fresh fruit on the counter, apples and oranges and bananas. And so when your children, for example, come in, that's what they'll see, and that's what then they'll go and get and have. What about the kinds of drinks that you have in the refrigerator? What would you like to, what do you think would be healthy to promote? Right, you want to promote juices, any kind of juices, but limit the quantity of juice with small children, because they tend to get attracted to it, and then they tend to drink too much juice, and it's too high in sugar. But juices, tea, we mentioned earlier, any of those would be healthier choices than some of the carbonated beverages. Milk is excellent, yes. We're going to do a little exercise here about eating based on the pyramid. So have the fruits and vegetables available at home. I think that's the most important thing. If you have children and your children don't really care for fruits and vegetables, go to the farmer's market or the grocery with them and have them pick their own fruits and vegetables. When they start taking an interest in the kinds of foods that are made available to them, that's what then they'll start eating. So make them more of an active participant in preparing meals, and that way they'll be more interested in eating. Now, some young children, they have very sensitive taste buds, and lots of fruits and vegetables, it's these colored compounds that tend to taste bitter. So that is one of the reasons why children are not necessarily attracted to some of the cooked vegetables. But if you keep offering them over time, it takes about 5 tastings of a fruit or vegetable for them to start liking it. So just be persistent. Don't force them, but make them at least take a bite so that they can start getting used to that flavor, perhaps that bitter compound, and they get used to what it tastes like, what it feels like, and that they'll be okay after they swallow it. Then you can start having it as part of the regular menu. The other interesting thing is the Dietary Guidelines, the current ones came out in 2005, and the new ones come out every 5 years. So this year, 2010, we have new Dietary Guidelines coming out. And we don't really know what they are yet, but there has been a lot of speculation that there's actually going to be more of a push for all of us to try to eat more fruits and vegetables and plan our meals around fruits and vegetables. When you think about planning a meal, what do you think of first? Meat. You're going to think about what kind of meat you're going to serve, right? And then you think about what starch goes with it. And then what's last, what you're going to think about? The vegetables that you're going to offer. And many times this is something that's convenient and easy. You might not take the time really to prepare. Well, in a lot of the cultures where some of the chronic diseases occur less, they plan their meals around vegetables. So they have their dinner plate would have lots of vegetables, and the meat is more of a side dish for them. And they might have several different types. They might have lentils or beans. They'll have different types of root vegetables, green vegetables, and blend of vegetables in a meal. And then, as I said earlier, the meat is more of an afterthought. And that is some of the talk that I'm hearing is that the next pyramid and that is supposed to come out in the guidelines that will come out this year. So think about planning your meals around vegetables and fruits and use the meat as a garnish. The other thing, what you might think about doing occasionally is having a completely vegetarian meal. How many of you might have had just a completely vegetarian meal occasionally? It's interesting when I go sometimes to meetings and there are meals that are planned and prepared and offered to people. And many times people who are not vegetarians actually choose a vegetarian meal. So think about having that too, where you actually plan your meal all around different types of vegetables. I think that would be healthy. And think about reducing the availability, as we talked about earlier, of the less healthy snacks and foods, so that you make your refrigerator healthier, what you offer and make available at home for your family. Think about the pantry, what you have in there currently. Think about how you can make what you have, your pantry, look healthier, so when someone does go there and wants to reach for something, that you have something to offer. For example, something that you can add into lots of foods that we don't think about having a whole lot are dried fruit. Nowadays, there are all kinds of dried fruits available. It's not just raisins, but you can have cranberries. We have blueberries that are dried, cherries that come dried. So think about having dried fruit, for example, in the pantry, because that makes an excellent, healthy snack if you're craving for something that's sweet. And then on the other hand, if you crave for something salty, somebody mentioned nuts earlier. Nuts tend to be high in calories, but the kind of fat that's in nuts is heart healthy. So it's a great idea to have both of those in your pantry. So depending, what you're craving for, whether it's for something sweet or whether it's something salty, you have something that's healthy there for you to have. So think about when you go to the store, and when you build a plate, that it looks like a rainbow, and that way you're having lots of different types of healthy phytonutrients. And I wanted to do this little exercise. So I want everyone to stand up. And then when I'm talking about eating based on the pyramid, if you're not eating this amount of something, I need you to sit down. So we'll see who's the last man standing here. All right, so this is on a typical day. Think about a typical day when you eat. So do you have about 5 to 6 ounces of meat? Okay, everyone's standing, all right. All right, no, okay. How about, do you have up to 2 to 3 cups of milk or milk products such as cheese, yogurt, ice cream? Okay. Do you have about 6 ounces of, or its equivalent of grains, like bread, rice, 6 ounces, pasta? Now, is about half of what you eat in terms of grains whole grains? Okay. Do you eat 2 cups of fruit a day? Okay. What about, do you eat 2.5 cups of vegetables a day? All right. Okay, now we're going to break down the vegetables a little bit more. Do you have about 3 cups of dark green vegetables in a week? Okay. Do you have 2 cups of orange vegetables in a week? Okay. Do you have about 3 cups of legumes in a week? Beans, lentils. What about 3 cups of starchy vegetables like potatoes? And other vegetables like onions, celery, 6.5 cups in a week's time. All right, great. Well, we have some people standing, so that's great. That means you are eating based on the pyramid.